Opioid overdoses in Oregon have been on the rise for the last 5 years. The Oregon Health Authority reports more than 1,000 overdose deaths and 9,000 emergency room visits in 2021 alone. To help combat this, counties across the country have been implementing so-called harm reduction practices. According to the CDC, harm reduction is a public health approach to reduce the harm that comes with drug use, like infectious diseases and overdoses. The approach can be giving out sterile syringes and distribution of naloxone, an overdose medication, and fentanyl testing strips. Since 2019, Multnomah County has given out syringes and gives opportunities for HIV testing and other sexually transmitted diseases. The county says in recent years it's seen a big decrease in use of syringes and more smoking and snorting of drugs. Organizations like the CDC and Johns Hopkins say offering harm reduction supplies like syringes helps link users to care and treatment services. To bridge the gap between those who inject drugs and those who smoke them, Multnomah County will now offer smoking supplies. The county says, quote, offering these supplies does not mean people will start using substances. Syringe access does not mean people will start injecting, just as offering condoms does not encourage young people to start having sex. Fox 12's Jeffrey Lindblom spoke to some recovering addicts to understand how they feel about the county's latest move.
The resources will be for drug users who don't use needles, so things like tinfoil and straws for opioid users, glass pipes for those who use methamphetamine or crack, or snorting kits. The county calls it an up-and-coming best practice in harm reduction amidst an overdose crisis. I spoke with some